Our next speaker is Dr. Lawrence Sanders. Among other things, Dr. Sanders is an internist by training. He is a past president of the of the National Medical Association. And for those of you who are not familiar with that, that is the largest and oldest organized group of physicians in the country. But he's also currently the interim executive vice president at Grady Health System in Atlanta, Georgia, and he's also the chief medical officer at the HEAL Collaborative. Dr. Sanders will address us today why early detection and screening matters. And I'm sure he's going to have a comment about that assembly line thing too.
All right, good morning, everybody. First of all, I want to just take a minute to say and honor the higher power that brings us together and whom, if we work with every day, will order our steps. I want to thank the Antioch congregation for making it possible for us to have this. And Ms. Morales, I want to thank you very much for telling your story and for setting the stage for what I'm going to talk about for the next few minutes. All right, thank you very much. I want to talk about a few things. I want to talk about prevention. I want to talk about what is primary care and why do I need it. I'm going to take a step back from talking just about cancer. I want to talk about what does primary care have to do with screening, what is screening and why should we think about it. And then I'm going to take a really little bit of a detour and I'm going to talk about why does the heart matter. We're here to talk about cancer, but I'm going to talk about why does the heart matter in all of this. And then I want to talk about what's food got to do with it. Is that a good way to go? All right, so let's start. Let's start with prevention. Prevention in my mind means doing things to keep something from happening. You okay? Doing things to keep something from happening. And so often when something doesn't happen, we say we don't need that prevention anyway. All right, so the public health system, you've heard of the Alabama public health system, the Birmingham public health offices, really where we talk about prevention. But I'm going to use an analogy to talk about prevention. I'm going to talk about your drain in your house because I think that's something we can all kind of connect to. All right? All right, most of us know, either from experience or because someone has told us, that you don't want to put grease and particles down the drain, so you don't do it, right? And if you follow that, most of the time your drain won't get stopped up. So that's what we call primary prevention. It means taking steps ahead of time to prevent something from happening. We're going to link it to healthcare in a moment because I thought Ms. Morales told us that story very well. Now, if your drain's not acting right and you think something is wrong, then you might get out the Drano, a few other things, and try to fix it yourself. That's what we call secondary prevention. That's when something's wrong and you want to do something about it. But then if it gets so bad that you can't fix it, then you got to call in the plumber. That's when we're at treatment or tertiary prevention. Now, I'm going to make this a little bit different, and now let's talk about healthcare. So that whole bottom line is about eating right, healthy lifestyle. That's primary prevention. When something's wrong and you really need to go get an assessment or you want to catch it early detection is what we talked about, that's secondary prevention. That's where primary care comes into play. And then the third layer is when you need to get treatment, that's where consultation and tertiary care and specialists come into play. So that's how we look at prevention from a healthcare. Now, there are three ways you can enter the healthcare system. You can come in through primary care, and now in today's world, there's an urgent care center almost on every corner, and then there's an emergency room. So how do you decide where you need to go? Well, primary care is where you go when you need somebody to kind of look at your whole health. They're going to kind of look at everything. They're going to do your annual checkups. They're going to treat almost all of your problems, and you build a relationship with them. Now, that's what you should do. But some of us wait until we can't stand it anymore. We got a toothache, we got an ear pain, we got something going on, and the urgent care is right there, so that's where we go. That is for that kind of thing, but it doesn't provide the comprehensive ongoing care. And then you got the emergency room. Now, many people use the emergency room as their primary care doctor because they wait till the last minute, and that's where they go. The emergency room is really for life-threatening emergencies. But I'm going to tell you like this. If something's wrong and you're not sure, that's where you go. All right? But what I really want to talk about is primary care. I want to talk about why it's important and what it is. When I need to know sometimes you need trusted sites on this web thing that we call it today, and you need places where you can go to get good information. One of those places I often go is something called the IOM, or the Institute of Medicine, although it's changed names now and it's called the Academy of Medicine, but it gives you good consensus definitions around things. What I'm going to talk about today is primary care. And what is primary care? It's a physician or other clinician working together with people in the community, the patient and their family, to take care of the majority of your healthcare problems, and to do it in the context of a partnership. And I use that word very specifically, in the context of a partnership and in the context of community and community resources. So it's about connections. That's what primary care is about. So why do you need a primary care physician or a doctor? Now, one thing I'm going to say here is that in today's world, you might not always have a primary care physician. You might have a primary care clinician who is either a nurse practitioner or a physician assistant working closely with that physician, but that's okay. So why do you need this? Because you need a partner. You need somebody who's going to work with you. And the one thing I heard in the early discussion is, look, I have to advocate for myself. And I'm going to tell you, that's true. That's really true. And so that primary care physician's got to be your partner, which means they got to listen to you. They got to listen to you, and they got to pay attention. And they really need to drive your healthcare plan with you in mind. It's about working together, not me as a physician telling you what to do. And then we got to talk about that thing I just talked about called prevention, and determine the necessary screenings. And if we do this, we identify the things that are seriously life-threatening, so we don't have to go to the emergency room when it's not necessary. We've got that primary care physician. And the other thing, if it works well, you've got somebody you can talk to, that you can feel comfortable with, because you got to talk about things with that doctor or that primary care clinician that you might not talk to anybody else about. You know? I used to tell people, I don't see patients regularly every day, but one of my things that I would say to folks is that the patient in front of me, we got to talk to each other. If we're not, let's turn off the lights and give each other a sword, and we just start swinging, because that's what we're going to do if we're not talking to each other. So that's an important thing about a primary care physician. So I pulled this from the University of Alabama in Birmingham about what do you need in a primary care physician. You need somebody you feel comfortable with. You need somebody whose office hours matches where your time matches. If they're open from 10 until 12 and you're working from 10 until 4, you got to find one that's open during the time that you got it, and you got to make sure that they're available when you need them. So that last thing is, what happens when after hours and what happens on weekends? Who's going to be there to help take care of you? And it also helps if you talk to someone else, and I think I heard this earlier. One of the best ways we can learn is talking to other people that we know and trust. Talk to somebody else who's seen that physician and find out what it's like, okay? Now, what are the signs, if you're working with that primary care physician, that you need to go see somebody else? I think you said it very well. Sometimes I just feel like they're not listening. I feel like they're rushing. I feel like they're putting me on a kind of line of patients to treat. And they're not paying attention to me. They're more concerned about what's going on with them. If I condense all this to the least common denominator of when it's time to find another physician, if that physician's not listening to you or you don't feel like they're listening, pick up your stuff and go someplace else. All right? And that's what I would say. Because one of the most important lessons I learned in medical school from a physician that I always think about and I always listen, and even in the work that I do today, that where I don't see one patient at a time, but where I sometimes say the whole hospital is my patient, is that as a physician, I need to understand and listen, and I need to listen long enough to understand what that patient is trying to tell me, because they know more what's going on with them and more about their illness than I do. And my job is to listen long enough such that I can help, to listen long enough and hard enough that I can help. And I think I heard that loud and clear as we listened to Ms. Morales. Okay, so if your doctor's not listening, move on. So why is the primary care important? How does the primary care help? Well, if we do something today to detect something earlier, it may do better in the long run. So it's about making decisions today to help in the future. So, early detection. By seeing the physician regularly, we find things early, we listen, we understand what symptoms there are. We keep track of things by looking at your blood pressure, knowing that your blood pressure's going up slowly. We can intervene and prevent problems down the road. We can do proactive care. That's what I mean by paying attention to things and getting out in front of them. Then we could also work with you around the things that we know that work, screenings. I'm gonna talk a little bit about that in just a moment. But screenings, what are they and why are they important? Immunizations, vaccinations are important because they prevent disease. They're probably one of the most important things that we have around prevention, no matter what misinformation you hear today, all right? And when it's time to see a specialist, that's what the primary care physician will do. We'll connect you with a specialist. And part of my way of thinking as a primary care physician, I had to trust that specialist that I'm gonna go send you to, because I'm sending my partner, somebody I've worked with, to see somebody that I want to do a good job for them. All right? So now, screenings. We've organized screenings by almost every part of your body to match your body. So we have screenings for every kind of organ, every kind of cancer, every number of things. And I say you got to have trusted resources, something called the United States Preventive Health Task Force defines which screenings are necessary and why they're important. And they even list them down by age. That's some things that after you turn 65, Howard said he turned 16. I'm gonna say, oh yeah, I turned 17. Okay, all right. And so it's laid out automatically, and you need to work with your primary care physician to determine what screenings are important for you at what time, and keep asking questions. So that's what I'm gonna say about screenings and why they're important, because screenings help us detect things early. They can also give you peace of mind that nothing was there, but I do want to make a point. If you feel something is wrong, even though I may tell you that as a physician that I don't see anything, if something's wrong, you keep talking to me, because my job is to listen. And I heard that kind of actualized as Ms. Morales told her story. Now, I'm gonna switch just a little bit. Why in the world do I want to talk about heart disease? You heard earlier that cancer is a leading cause of death among cancers. Heart disease is a leading cause of death for people in this country, period. And so if we can keep your heart healthy, we might be able to keep the rest of you healthy in a way as well, okay? Now, what I would say is that 1 person out of 5, every death, dies of heart disease. And if you take that in terms of numbers, almost every 30 seconds, somebody dies of heart disease. And the picture on the left side of the screen shows the leading causes of death in 2023. 2024. It lags always by about 2 years. You see heart disease, you see cancer, you see respiratory, you see accidents, you see strokes. Now, I want you to focus on that bottom box that says leading causes of death in 1900. Well, more than 100 years ago. What do you see? First, you see infectious diseases. Influenza, tuberculosis, diarrhea, enteritis. Infections. Remember I said vaccines are important? Because vaccines helped us get rid of or prevent most of those kinds of infections. But we also cleaned up water, we cleaned up a number of things, and we figured out how to live together better. But once you drop down, what do you see? Heart disease, stroke, kidney disease, accidents, almost in the same order as they are today. So it speaks to our human condition. So what must we do? Well, if I talk about heart, there are a number of things that can go wrong with your heart. You got valves in your heart that can go wrong. You got the muscle. The heart is a muscle. The muscle can stop working, or it can get clogged up with stuff and stop working. come on around. The heart is an electrical tool because it sends electrical things that keeps it beating every day. Those can get messed up. And then finally, the arteries can get clogged up with stuff, just like I talked about the drain pipes early on, right? All of those can cause heart disease. And what we want to do is work together to prevent it. Heart screenings. What is a heart screening? Why is it important? Who should be screened? If you got a family history, if you've got something going on that you don't think quite right, you get short of breath every time you walk, or you feel like you're dizzy, you don't feel quite comfortable, then you ought to go get screened. Those are the people who should get screened. So what is a screen for heart disease? First of all, you need to get the blood pressure checked. You need to get the blood pressure checked on a regular basis. That's the most important thing. And if it's abnormal, then we need to move on to get something we call an EKG that looks at the electro part of that heart. And then we can do something called an echocardiogram that looks at the muscle part of that heart. And then we put it all together and figure out what's going on. That's how we screen for heart disease. And so if we can keep, I said earlier, if we can keep your heart healthy, we might be able to keep the rest of you healthy, because the same things that keep your heart healthy help prevent other diseases. And so the first one we see up there, and I think we heard this, but not always, if you smoke cigarettes, quit yesterday. All right? Limit the amount of alcohol that you drink. Schedule a regular checkup with your doctor. One important thing we don't think about, got to get a good night's sleep, because that's where your body recharges. You're not sleeping right, think about it. That might be something to talk to your primary care doctor about. You got to eat a healthy diet. Now, what does that mean? I'm going to start with one, and I'm going to keep going. But you know, I'm a Southerner as well. I grew up in South Carolina. And there's something about fried foods that we all like. The reason I started with that story about the drain pipe, because we all know it. Because we don't pour grease down that drain pipe. But you sit there and eat that grease and have it clog up your veins. And look, I'm not trying to stand up here and be funny, because I'm a part of that. Remember, I grew up long before I was a physician, all right? So I understand those things. But that's what eating healthy is about. If you got a chronic disease, let's go see the doctor. Let's get it managed. Keep your blood pressure controlled. If you got diabetes, let's keep your blood sugar controlled. Let's manage that. And then finally, got to get up and do something every day. A little bit of exercise. It don't have to be much. Just a little walking can help. Just movement can help. But those are the important things. And now if I take it one step further and say 10 ways to improve your heart, I'll go through these 10. The first one I'm going to start with is exercise. But then I go to something about reach for healthy fruits and vegetables. Then I go to choose whole grains. Number 4, include healthy proteins in your diet. Number 5, watch the kind of fats and oils you use. I grew up in a place where they used something called lard. But we don't see that no more. We go to vegetable oils. I see people laughing because they remember. I remember I told you I turned 17. All right? All right? And so then we move on. We process foods. Need to watch them. Things that come in bags, they taste good. They got a lot of salt. Then we move on to talk about watch the amount of sugar that you eat. Now, I didn't say don't eat sugar. But if you eat too much, it's not good for you. Salt. You know, sometimes salt is like sugar. I'm going to tell you this story, and then I'm going to kind of move toward the end. How did you learn how food tastes and what tastes good? Usually it's your parents or somebody working with you when you're a little kid. They put a little salt on it, they taste it. And a little bit more, they taste it. Sometimes that looks like genetics, because we learn how to eat from our parents. So that salt thing is something we may have to work with together. And again, I get back to limiting alcohol. And if you put all this together, now how do you know when you're eating right? The more color you have on your plate, the better off you are. And that's what it should look like when you sit down to eat. That's got lots of color, right? So hopefully we've talked about a few things. We talked about prevention. We talked about primary care. We talked about screening. We talked about how your heart ties everything together and how food and what you eat really gets to the bottom of it. I'll be around to ask questions, so thank you very much.